More vaccines to more people, but more questions and concerns are popping up as well. Is it safe? And what side effects will happen to me? Where can I get it? And how do I prove that I have the vaccine?
So for the next 30 minutes, we're answering all of your questions, from the virus itself to the vaccine and how both of those things can impact pregnancy. We Together, a coronavirus discussion.
And thank you for joining us for this special discussion tonight. I'm Brooke Ludington.
And I'm Molly Pat. Week after week, we hold these special discussions to answer all of your questions about anything coronavirus. So anything you want to know, we bring it straight to the experts.
And joining us tonight from Topeka's Stormont Vale Hospital, Dr. Sri Donapudi and Dr. Laura Hughes, who is a fetal medicine doctor. So thank you both for joining us tonight. And before we get to our questions, we do want to quickly go over some numbers real quick. So today is the first day where anyone 16 and older in Kansas is eligible to sign up for the COVID vaccine if they want. And with that, the state health department says more than 1.5 million doses have gone out across the state.
And over 1.1 million vaccines have been administered in the state so far, with 777,000 people in Kansas receiving at least their first dose, which makes up 26.7% of people in the state. So we want to get right to our first question because we have a lot of viewer questions that came in, so let's get right to it. Dr. Donapudi, the state is investigating a woman's death that could possibly be related to getting the COVID vaccine. She had a severe allergic reaction after getting the shot. So what would you say to people who feel extremely nervous to get the vaccine because of something like this, even though we know that experts say that the vaccine is really the light to end this pandemic?
So first of all, Molly, I would definitely want to say, our deepest condolences to the family, first and foremost, and certainly we can't discuss any of the specifics of the case, but there's an ongoing investigation right now, but at this point we cannot say that there's a causal link between the vaccine and her death. Out of 150 million vaccines that have been administered, 0.0018% have had a death in that time period following vaccination. That's just a little over 2,000 people, and not a one of those cases was causally linked back to the vaccine. So while there's still an investigation ongoing into the particulars of this case, it is definitely safe. And certainly if you have any concerns, you should speak with your provider, especially if you have any history of severe allergic reactions in the past.
And Dr. Hughes, I also want to ask you, so what about women who are pregnant or trying? They already may be anxious or hesitant about it, and now they might be feeling like, okay, this just isn't worth the risk. So what advice do you have for them?
Pregnant women are at increased risk for severe disease with COVID-19 infection. Pregnant women who are symptomatic are more likely to be hospitalized, more likely to need a ventilator, and more likely to not survive the infection. On top of that, many pregnant women have received the vaccine so far. As of February, 60,000 pregnant women in the United States have received the COVID-19 vaccine and are being followed via the V-Safe CDC program. There have been no adverse pregnancy outcomes to date.
And so basically they should still go through with it. What about even women who I would just say have had allergic reactions in the past? Should they just be hesitant? I'm specifically talking about pregnant women or women who are trying to get pregnant.
Certainly anyone with a severe allergic reaction in the past should talk to their provider before they decide to get the vaccine.
And on that same note here of side effects, Dr. Donapudi, Kimberly Holloway says that after receiving the vaccine, Moderna specifically, she's been dealing with severe side effects for over a week, like chills, body aches, memory fog, and not being able to hold down food. So my question is, what is the percentage of people dealing with side effects from vaccine shots?
So side effects from the vaccine shots are not terribly uncommon, but are typically headaches, body aches, chills, and sometimes fever, but do typically resolve for most people in that 24 to 48 hours, sometimes as long as 72. If Kimberly has actually been having symptoms over the course of a week, she should really be connecting back to her provider for some potential further evaluation. You never know what she might have been exposed to prior to receiving the vaccine, but for symptoms a week out, that really should not be vaccine related at that point.
And Dr. Donapudi also talking about side effects. Something I've seen from a few friends and we also have reported on is a side effect from the Moderna shot, a red and raised circle at the injection site, and some have been there for a few weeks even. So people are wondering if that's normal, if it's an infection at the injection, or just a side effect from the vaccine, and what should they do?
Yeah, redness and swelling is actually a common side effect with any of the vaccines. And if you do have some residual redness, but it's not particularly tender or hot to the touch or any drainage or anything like that, even if that persists a little bit longer, I wouldn't be overly concerned about that. But certainly if they have any concerns, they can touch base with their provider. Other than the redness and swelling at the vaccine site, sometimes people will also get some swollen lymph nodes on that same site, and for that reason we recommend people do not get a mammogram right after having the vaccine. So you really want to have probably about 4 weeks after getting the vaccine, or do it 2 weeks before getting the vaccine because of the potential for the false positives. But some of those local types of side effects can persist a little bit longer, but what we call systemic side effects like the fever, the chills, the body aches, headaches, that kind of thing, that really should resolve within that 72-hour window.
Good to know.
And Dr. Donapuni, I want to get one more in for you as well. So we're getting this one asked a lot. So Kay Anderson, this is just one of them that she asked. She says, can you again explain how we can get the card showing that we have been vaccinated for coronavirus?
I get this question every single day. So first, let me provide some clarity. The reason why that card, the main purpose of that card, was really to provide a record of which vaccine you received for both you and for the vaccinator who would be seeing you back for that second dose, so they could verify they were giving you the same vaccine at the correct interval. That's really the main purpose. There is no requirement nationally or from KDHE to use the vaccine card specifically, but because of that intent, you should always receive documentation when you get the vaccine of that same information and the lot number, et cetera, regarding the vaccine. And whichever site that you go to, you should always be receiving that in one form or another. Many large sites, meaning sites that are seeing a lot of patients for their vaccination, and sites that have an electronic medical record, they can serve more people more efficiently and effectively by not using the handwritten card. And again, there's no requirement to use that card, so they produce that information out of their electronic medical record. Mayo does this, Northwestern does this, and many large health systems nationwide. There is currently no requirement from anyone to produce your evidence of vaccination, with the exception of maybe a free donut from Krispy Kreme, if I understand correctly. And even that, they're not going to quibble over what format you provide it in. We don't even do the pink cards for pediatric immunizations anymore. Cards get lost, they get damaged, and honestly, this is a continued process of evolution with variants, potential boosters on the horizon. Right now we have a 6-month window where we consider that vaccination as protective. That may be extended again as we start getting close to that 6-month window. But at this point, not only is there no requirement to show proof of vaccination, that is likely going to change within the next 6 months to a year. So I would encourage people to not get fixated on the format that they have their vaccine documentation on. And if you need a more succinct format, if you did get it through the vaccine clinic, for example, that can be printed out of my chart yourself, or you can contact your provider's office or medical records, and they can print a 1-page document, about a half-a-page document that has that information. And about mid-April, we were able to get a fix into our electronic medical record that will actually print it in the size and same format that the vaccine card has, but on paper with the discharge paperwork.
Definitely good information there. Now, Dr. Hughes, some newborns have tested positive for the virus that causes COVID-19 shortly after. We've read that from the CDC. So why would that be? Are those antibodies? And then do these newborns have symptoms of coronavirus? Kind of walk us through what that looks like.
We are concerned that pregnant women may be able to give the virus to their unborn babies, but it seems to be rare. And the babies who have appeared to be infected so far have done very, very well overall.
Okay, good to know there. Now, Dr. Donapudi, Terry Albert also wants to know how long you have to wait to get the vaccine after having COVID-19.
So the main criteria is that you're out of the isolation period. So that is typically 10 days from your test or the diagnosis of COVID-19. That first 90 days after having an infection, you have some natural immunity from having had the infection. So if you wanted to, you could wait until after that 90-day period, but there's no recommendation against it. There's no what we call a contraindication to receiving it within that 90-day window, as long as you're out of the isolation period, so you're not presenting a risk to anyone else.
And Dr. Hughes, let's talk about if a mom has COVID-19, does the virus spread through breastfeeding? And what should new moms be aware of if they find themselves in this situation?
It doesn't appear that it's spreading through breastfeeding, so that's great news.
Is there any way that any symptoms, or if a mom has coronavirus, that it would be spread through a baby? I know that you touched on, you know, if pregnant moms do have coronavirus, it can be really severe. So what does that process look like, and how can those women really get through it? And is there any, you know, concern that it could go to their baby then?
You know, we are very careful with the moms and babies when the moms are positive for COVID-19 at the time of delivery. They do a lot of good hand washing and wear their face masks around their babies.
And just out of curiosity, have you seen an influx of moms even just lately, or has it just mainly been in the last couple of months where you were seeing pregnant moms coming in testing positive for COVID?
We are seeing pregnant women coming in and testing positive for COVID-19.
Even still to this day, even just recent?
Yes.
Okay. That's good to know. I mean, it's just something to know that it's out there. I think a lot of us, you know, maybe letting our guard down a little bit with the mandates going down with the mask mandates and everything else. So good to know to still be on alert. Well, we are going to take another quick break, but when we come back, we're going to talk about the possibility on if a newborn can test positive.
And why we may be wearing masks for quite some time. So stay with us. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vale now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Find out if your favorites make it to America's Vote.
There's only one more slot in our top 24.
American Idol new ABC tonight.
Release the hounds!
America's top groomers compete in the ultimate transformation challenge. Who will be best in show?
This is the show where every dog's dream can come true.
Who's Perfect premieres Tuesday on ABC.
The COVID vaccine.
Let's talk about it.
Historically, there's a lot of distrust. We get it.
But people of color are disproportionately affected by this virus.
Too many of us are dying.
We are worried about our patients. We are worried about our community.
We've safely taken other vaccines, polio, tetanus, flu.
Now COVID. It is time to stop the spread.
An emergency situation requires an emergency response.
80% of the U.S. population needs to be vaccinated, including people of color.
So when my time came, I took my shot.
I took my shot against COVID. What about you?
Do it for your family.
Do it for our future.
The COVID vaccine can save your life and the life of your loved ones.
Take your shot for our people.
Welcome back to our special coronavirus discussion, where we're taking your questions straight to the experts.
Again, tonight we're joined by two doctors from Topeka Stormont Vale Hospital, Dr. Sridhana Pudi and Dr. Laura Hughes, who is a fetal medicine doctor. So, Dr. Hughes, talk about some advice that you have for moms in this pandemic, even being pregnant. We're going to take this viewer question down real quick because we already touched on this earlier. So we just want to talk to you about advice that you have for new moms. Being pregnant, I can imagine, I've never been pregnant myself, but I can imagine, you know, you already have anxiety and you're anxious a little bit, you know, wanting to keep yourself healthy, and add a pandemic into it adds on the stress and everything. So what advice would you have for new moms going through this pandemic?
For new moms, we definitely recommend vaccination. There is a fairly new study that came out that suggested that women who are vaccinated pass antibodies to protect their newborns against COVID-19, and they can get it both through the placenta and through breast milk. And the immunity that they can give their baby is significantly greater than they can get with getting the infection itself. So being vaccinated is a benefit to both the mother and the baby.
And Dr. Donapudi, Mario wants to know, why do people have to wear masks even after receiving the vaccine? He says that he hates wearing masks because they fog up his glasses and make him cough.
So that's a great question, and I know we're all eager to get to a sense of some normalcy. So bottom line, the data regarding the ability to transmit infection or carry infection to someone else is still evolving. We do believe that vaccination status does significantly decrease that risk that you serve as what we call a vector, a source of exposure for someone else. But the other piece is that no vaccine is 100%. So these vaccines significantly decrease your chances of COVID infection, and almost 100% decrease your chances of severe disease or hospitalization. But there is still that possibility that you may get a mild COVID infection. And if you have a mild COVID infection, you may not even think twice about it. You know, the sniffles, et cetera, especially in the season of allergies right now. And that mild infection for you could serve as an exposure for someone else who isn't vaccinated that could have a much more serious outcome.
Yeah, definitely a reminder for all viewers, you know, even though it might seem like this has gone on forever, definitely still take those precautions. Now here is another question, Dr. Donapudi, I would like you to give your take on. Jim Goodyear wants to know why ivermectin isn't being used to treat and prevent COVID.
So I'm not sure where this particular information or question drove from, but ivermectin is a medication that is used to treat parasitic infections, lice, etc. There is no data supporting it for use of COVID-19, so it does not have a place right now in our wheelhouse for treatment.
And I'd like both of you to weigh in on this next question. First, the governor has opened up shots for everybody over 16. Are all of the vaccines approved in people over 16, or do some of them apply to people over 18? So Dr. Hughes, I'll let you start with this one, and maybe you can also talk about if some are better than others for pregnant women.
My understanding is they're all now approved for 16 and above, and a pregnant woman can take any of the vaccines.
And Dr. Donapudi, do you have anything else to add about the 3 different brands and when it comes to age, especially as we, enter into phase 5 here in the vaccine plan?
Sure, and let me clarify. Pfizer is approved for 16 and up, but Moderna and the Johnson & Johnson vaccine are only approved for 18 and up. So for that 16 to 18 age group, Pfizer is really the only option that is approved for them currently. Now, there are studies that are going on right now for the younger populations, I believe actually for all 3, looking to expand the use in pediatrics even, but currently that's where their emergency use authorizations are.
And just out of curiosity, do you know why it's just Pfizer and Johnson for 18 and up as opposed to Moderna not being approved for 16?
So only Pfizer is approved for 16 and up. So both Moderna and Johnson & Johnson are 18 and up right now. And that just has to do with the study population that they had in getting their emergency use authorization. And so again, all 3 of them are doing further studies now. It's a lot harder to get pediatric participants in a study, as you might imagine. There would be a lot more hesitancy potentially for adults, and certainly a lot, parents, excuse me, and certainly a lot more involved for consenting a pediatric patient to participate in an investigational study for a medication. So Pfizer had 16 and up included in their study data when they applied for their emergency use authorization, so that was how they were granted that, that age range. And then again, all 3 of them are looking to expand their age eligibility.
And Dr. Hughes, I mean, you've been in fetal medicine, I can imagine, for quite some time. When you just look back on the other vaccines, that have kind of been tested or whatnot, how does that work with these pediatric patients or just even children so young like that?
I am not a pediatrician, so I can't speak to that. I'm sorry.
Well, that's okay.
That's all right. We'll ask somebody next Monday. Monday after Monday, we're here.
Well, we are going to take another quick break, but don't go anywhere. Once we return, the doctors will be answering more of your questions.
Plus, we'll get final thoughts and takeaways. That's all coming up right after this.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
La vacuna para COVID. Hablemos al respecto.
Históricamente hay mucha desconfianza, entendemos.
Pero las personas de color son afectadas desproporcionalmente por este virus.
Muchos de nosotros están muriendo. Estamos preocupados por nuestros pacientes. Estamos preocupados por nuestra comunidad.
Hemos sido vacunados contra otras enfermedades como polio, tétanos y la influenza. Ahora COVID. Es hora de detener la propagación. Una situación de emergencia requiere una respuesta de emergencia.
El 80% de la población necesita vacunarse, incluyendo a las personas de color.
Así que cuando llegue el momento, me vacunaré. Yo me vacuné contra el COVID. ¿Y tú?
Hazlo por tu familia. Hazlo por tu futuro. La vacuna contra el COVID puede salvar tu vida y la vida de sus seres queridos.
Vacúnate por los nuestros.
Okay, what's green takes away your blues and gets you out of the red. $25,000.
It's the 25K Workday Payday, starting Thursday at 8 a.m.
on Magic 107.7.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vale Health, empowering you together.
Have you tried the 4-in-1 power of Persil Oxy Discs? They remove tough stains, deliver fiber care, freshness, and a deep clean. Try Persil Oxy Discs.
And we are back for our final few minutes of our coronavirus discussion, taking the time to answer all of your questions you've been emailing into us. And joining us is Dr. Sri Donapudi and Dr. Laura Graham, both from Topeka's Stormont Vale Hospital.
And so we started the top of our show tonight talking about a Kansas woman's death being investigated since she died a day after she suffered a severe reaction to the COVID vaccine. So when it comes to reactions, Caroline Harder has a good question that we'd like both of you to weigh in and get your opinions on. So she wants to know, if I get the COVID-19 vaccine and have a reaction, will the nurse give me an epinephrine injection ASAP, or will they just call 911 and make me wait to get the epi injection?
So that's a great question, and every site that is administering this vaccine in particular, but really generally vaccines in general, every site that is administering this vaccine needs to have rescue services on site and available. Basic rescue services like Benadryl and epinephrine, et cetera, and the ability to assess a patient and to stabilize them while getting additional help. Our site is no exception, but every site should have those services available. In our particular site, we address that. We have a medical bay, and we have a provider on site. So anyone who is needing additional support or has any symptoms that they're concerned about will be assessed in our medical bay and potentially given Benadryl, epinephrine, and monitored. And if their symptoms are severe enough or they need additional support, 911 would be called and an ambulance could transport them to the emergency department for further evaluation and stabilization.
And Dr. Hughes, what is your take on when somebody has a severe reaction to the vaccines?
I think Dr. Donapudi explained it perfectly.
Kind of same protocols there, then that's kind of what you've been also briefed on as well?
And any moms that you know that have gotten the vaccine, have they had different side effects? Should new moms be, or pregnant moms, be aware of any different side effects that they should be feeling if they were to get the vaccine?
Pregnant women will have side effects that are similar to the general population, so the muscle aches, some soreness in the arm, sometimes a fever. Very, very well tolerated, usually pretty mild and goes away in a day or two. And pregnant women can take Tylenol to treat those symptoms.
And I was just going to ask, is there anything else that pregnant women can do to relieve either COVID-19 symptoms that they're having, because we know that they can be pretty severe, or to help their vaccine side effects, or anything that they should stay away from? So anything to stay away from, or what they should be taking to help?
For side effects, Tylenol is the way to go.
Cut and dry, I love it.
Yeah. Okay, now I do want to give both of you the opportunity to tell anyone watching right now the key takeaways that you hope that they learn from our discussion tonight. Could be something that we've already talked about, or something that we haven't even touched on yet. So, Dr. Donapudi, I'll let you start. And one question I did want to run past you real quick as you're giving your final takeaways as well, is has the Stormont-Vail Event Center received the Johnson & Johnson vaccine?
Unfortunately, we have not. So there was supposed to be a significant increase in supply towards the end of this month, but due to some production delays and issues, the state did not receive that increase in supply that they were expecting to. So the limited doses that they have, they are distributing across the state, and I know our county did receive some in order to be able to get to those most at-risk populations like homeless, et cetera. Where the one dose is going to be really critical. So we're looking forward to a time when we have a significantly higher availability for that particular vaccine. I know some folks in particular are interested in that, especially with being able to do one dose, where we might be able to offer it in the vaccine clinic, but certainly does also open up avenues due to the less stringent requirements around the handling and the preparation of the vaccine to be able to offer it more broadly in other environments across the state and across our clinics.
And Dr. Hughes, before we get your final thoughts, Dr. Donapudi, real quick, are you guys going to keep the event center a vaccine clinic for weeks and months to come, potentially, as we get closer and closer to the pandemic coming to a close?
Great question, Molly. So our original lease was through the end of May. Through the generosity of the county commissioners and the event center management folks who granted the use of that space to serve this community need. They have agreed to extend that lease through the end of July. But what's interesting is that part of the reason why the state moved more rapidly to phase 5 is in phase 3 and 4, we were starting to see in some areas of the state some difficulty filling those appointment slots due to vaccine hesitancy or other reasons that folks aren't seeking it out. So that was part of the reason why the state moved to phase 5. So we're excited to be there. We're hopeful that people will continue to seek out the vaccine, and now folks who weren't eligible before can get it. But depending on what percentage of people across the state are interested in being vaccinated at this time, we may reach an end of the use for a mass vaccination site like the event center sooner than what we originally anticipated, and be able to serve the community's needs through other venues like the pharmacies who are also vaccinating, and potentially clinic sites.
Great. Dr. Hughes, in one sentence, any final key takeaways for people watching tonight?
The COVID and Pfizer vaccines cannot cause gene mutations. They will not limit your fertility. And none of the vaccines can cause us to get COVID-19 infection.
All right, wonderful way to wrap it all up. And that is all the time we have for now. Thank you both so much for taking the time out of your busy day and schedules to be here with us tonight and answering our questions. And we want to thank you, the viewers, for watching and sending us your questions.
Yeah, so if you still have a question, or we didn't get to it, or it came to mind while watching, keep sending them our way. You can email them to us at coronavirus@ksnt.com. Have a good night.
The COVID vaccine.
Let's talk about it.
Historically, there's a lot of distrust. We get it.
But people of color are disproportionately affected by this virus.
Too many of us are dying.
We are worried about our patients. We are worried about our community.
We've safely taken other vaccines: polio, tetanus, flu.
Now COVID. It is time to stop the spread.
An emergency situation requires an emergency response.
80% of the U.S. population needs to be vaccinated, including people of color.
So when my time came, I took my shot.
I took my shot against COVID.
What about you?
Do it for your family.
Do it for our future.
The COVID vaccine can save your life and the life of your loved ones.
Take your shot for our people.